Many older adults assume strength fades during walking, climbing, or lifting, when in reality the decline often shows up earlier. It appears in those first quiet moments of the morning when the body has rested, but the joints still feel guarded. That is when the legs may feel heavy, the knees may feel stiff, and the first few steps may feel uncertain. A person can remain independent for many years, then slowly begin noticing hesitation, shakiness, and weakness after waking up. In many cases, that change is not caused by age alone, even though age certainly plays a role. It is also connected to how the muscles, joint circulation, and nervous system prepare for movement each morning. That is why stretching, while helpful in its own way, is usually not the whole answer for adults over 75. Stretching can lengthen tissues and reduce the feeling of tightness, but it does not always switch muscles on effectively. And if muscles are not switched on, the joints receive less support, the body reacts more slowly, and balance may suffer. Those early steps then happen with sleepy muscles, reduced coordination, and less protection around the hips, knees, and ankles. This is exactly why simple bed exercises can matter so much more than people expect at this age. They do not need to be intense, exhausting, or complicated to make a meaningful difference in daily life. They simply need to help the body wake up in the right order before it takes on your full weight. On this health information channel, our goal is not to promise miracles or replace personal medical advice. Our goal is to share practical, science-informed ideas in plain language that older adults can actually use safely. In today's script, we are ranking 5 bed exercises from helpful to most impactful for safer, steadier mornings. Each one supports a different piece of the puzzle, from circulation and joint comfort to strength and standing stability. And by the time we reach the final exercise, you may understand why one movement can influence much more than posture. It can affect confidence, balance, walking quality, and the ability to keep doing everyday tasks without extra assistance. So, before you think about getting out of bed tomorrow morning, think about preparing your body to move well first. That small change may seem simple, but for many older adults, simple changes are exactly where independence begins. A lot of seniors already do some kind of morning stretch, and that is certainly better than doing nothing at all. But stretching mainly addresses flexibility, while the aging body also needs muscle activation, blood flow, and movement control. Activation means getting muscles ready to do their real job instead of simply making them feel longer or looser. Those jobs include stabilizing joints, improving circulation, supporting posture, and helping the brain guide the body more accurately. Without activation, the first movement of the day may happen with cold tissues and delayed muscle response. That combination can make standing, turning, and taking the first few steps feel more awkward and less secure. Older adults are especially affected because muscle function naturally declines with age, particularly after the mid-70s. At the same time, the body may recover more slowly from inactivity, and the nervous system may respond less quickly. That means even a short time in bed can leave the legs feeling stiff, disconnected, or difficult to trust. This is one reason structured movement matters so much for older adults who want to stay independent longer. Research consistently shows that strength, balance, and functional exercises support mobility better than passive flexibility work alone. That does not mean stretching is bad, because it still has value for comfort and range of motion. It simply means stretching should not be the only thing preparing your body for standing and walking. The body needs blood-moving joints, lubricated muscles awake, and movement patterns rehearsed before carrying full body weight. That is exactly what well-chosen bed exercises can help provide in only a few minutes each morning. They offer a safer bridge between rest and activity, which is especially valuable for people who feel fragile upon waking. And because these movements are done, while the body is still supported by the bed, they are easier to begin. That makes them realistic for older viewers who may feel intimidated by long exercise programs or traditional workouts. So, the real question is not whether stretching has a place, because it absolutely does. The real question is what else the body needs before standing, and that is where this ranking becomes useful. 5 ankle pumps and ankle circles. This exercise usually gets ignored because it looks too easy to matter, which is exactly why people underestimate it. But for older adults, the most overlooked exercises are often the ones that quietly solve a very important problem. That problem is sluggish circulation in the lower legs, after lying still for many hours during the night. When you remain in bed for a long time, the calf muscles are not doing much active pumping, and those calf muscles help push blood back upward through the legs during normal movement throughout the day. If that system stays sleepy, the lower legs may feel heavy, swollen, slow, or strangely disconnected in the morning. That is why ankle pumps and ankle circles are such a smart place to begin the routine. They are gentle, they are simple, and they help prepare the body before the first full step happens. To do them, lie comfortably on your back with your legs extended in front of you on the bed. If your knees or lower back feel sensitive, a small pillow under the knees can make the position easier. Point your toes downward toward the end of the bed as far as feels comfortable, then pause briefly there. After that, pull your toes back toward your shins as far as you comfortably can and pause again. That forward and backward motion counts as the basic pump, and doing it slowly matters more than doing it quickly. If you rush, it turns into foot wiggling instead of true ankle and calf activation. After 10 slow pumps, move into ankle circles, rotating one direction first, and then reversing for the same amount. This part wakes up the smaller supporting muscles around the ankle that help you feel steadier while standing. And that matters because the ankle is one of the first places where balance problems start to show. Many people think balance begins at the hips, but your feet and ankles are part of the foundation. If that foundation is stiff, weak, or slow to respond, your whole body may feel less secure immediately. That is why this modest exercise earns a place in the ranking, even though it is the simplest one. It does not build major strength by itself, but it creates a better starting point for everything that follows. For older adults who wake with heavy lower legs or uneasy first steps that can already feel surprisingly meaningful. 4. Heel slides for stiff knees and safer mornings. If your knees feel rusty in the morning, this next exercise may quickly become one of your favorites. Many older adults describe waking up with knees that feel tight, creaky, reluctant, or simply hard to trust. That sensation is often worse before the joint has had a chance to move through its normal range. And when the knee feels stiff, even simple tasks like standing or turning can feel more stressful than they should. Heel slides help address that problem in a very controlled and gentle way, while the leg remains supported. Because the bed is carrying the body, the knee can move without dealing with full body weight immediately. That makes this exercise especially useful for older adults with morning stiffness or osteoarthritis-related discomfort. To perform it, lie on your back with both legs stretched out in a comfortable starting position. Slowly slide one heel along the bed toward your hips, bending the knee without forcing the movement. Go only as far as feels manageable, and avoid pushing into sharp pain or a strong pinching sensation. Hold the bent position briefly, then slide the heel back out until the leg is straight again. That return phase matters just as much as the bending phase because it teaches control to the front thigh muscles. And those muscles are critically important when lowering yourself into a chair or going downstairs safely. A helpful detail is keeping the kneecap facing upward throughout the motion instead of letting the knee drift sideways. When the knee rolls inward or outward, stress may become uneven through the joint over time. Keeping the motion lined up helps build better movement habits instead of rehearsing poor mechanics every morning. Another benefit of heel slides is that movement helps the knee joint feel more lubricated and less guarded. After hours of stillness, many joints simply need motion to feel smoother and more cooperative. This does not mean heel slides will cure knee arthritis because that would be far too strong a claim, but they can help the joint feel warmer, looser, and more ready for standing than it did moments earlier. For seniors who dread the first bend of the knee each morning, that is a very practical advantage. And once the knees feel more prepared, the rest of the body often becomes more willing to move too. 3. Supine marching for clearer steps and better core control. This is the point in the routine where the exercises begin doing more than warming up circulation and joints. Now, we start training movement patterns that directly affect walking quality, step height, and balance confidence. One of the most dangerous changes in older adults is not dramatic weakness, but a gradual shuffling pattern. The feet stop clearing the ground properly, the steps become shorter, and tiny obstacles become bigger hazards. That is where supine marching becomes far more valuable than its simple appearance might suggest. This movement strengthens the hip flexors, wakes up the lower abdominal area, and challenges deep core control. Those muscles matter because they help lift the leg during walking and stabilize the body while that happens. If they are weak or poorly coordinated, the body may start dragging the feet instead of stepping cleanly. And once that happens, rugs, thresholds, and uneven surfaces become much more dangerous than they used to be. To do the exercise, lie on your back, with both knees bent and both feet resting on the bed. Place your hands over your lower belly so you can feel when the core is staying gently engaged. Then slowly lift one knee toward your chest, while keeping the lower back from peeling away off the bed. That detail is extremely important because it separates useful muscle activation from sloppy compensating movement. If the lower back arches the body is borrowing motion from the spine instead of controlling the hip well, that can reduce the value of the exercise and over time may irritate the lower back. Lift only as high as you can without losing that sense of control through the middle of the body. Pause at the top briefly, then lower the leg slowly instead of letting it drop carelessly back down. That lowering phase is where older adults often build the most meaningful control through the core. Then repeat on the other side, moving in a calm, deliberate pattern rather than a rushed marching rhythm. This exercise helps rehearse the very action that begins every step you take during the day. It teaches the body to pick the leg up more clearly and control the trunk while doing so. For older adults who notice shuffling poor foot clearance or a weak feeling through the lower belly that matters, it may not look dramatic from the outside, but functional movement improvements rarely begin with dramatic-looking exercises. They begin with controlled practice of the exact abilities you need in daily life. And clearer steps, better trunk control, and less shuffling are daily life abilities worth protecting. 2. Straight leg raises for stronger thighs and better standing power. If there is one muscle group older adults feel every time it weakens, it is the quadriceps. These are the large muscles along the front of the thighs that help straighten the knee and support body weight. They are heavily involved when you rise from a chair, control your body, on stairs, or lower yourself safely. When these muscles weaken daily, life often starts feeling more tiring, awkward, and dependent on hand support. That is why straight leg raises sit near the top of this list. They are simple, supported by the bed, and highly relevant to real-world independence. To begin, lie on your back with one knee bent and the foot planted for support. Keep the opposite leg straight out in front of you on the bed in a comfortable starting position. Before lifting, tighten the thigh of the straight leg by pressing the back of the knee downward gently. Then slowly lift the straight leg up until it reaches a moderate height that still feels controlled. You do not need to fling it high because height matters far less than tension and control here. Pause briefly at the top, then lower the leg slowly instead of letting gravity do the entire job. That slow lowering phase is especially valuable because it builds the kind of control needed during daily movement. In everyday life, older adults often struggle more with lowering than with lifting. Sitting down carefully, stepping down, and controlling body weight all rely heavily on that kind of strength. That is one reason straight leg raises deserve to rank above the previous exercises in this routine. They are not just waking the body up anymore, they are actively strengthening a major mobility muscle group. And that strengthening happens without forcing the knee to carry your full body weight during the exercise. For older adults with weak thighs, that makes the movement both accessible and highly functional. As the weeks go by, some people can gradually increase the hold at the top or add light resistance. But the goal is never to rush progression or chase strain just to feel like you worked harder. The goal is to help. Standing, sitting, and walking feel safer and more controlled over time. For many seniors, better quadriceps strength means less pushing off with the arms and less fear on stairs. And when that begins to improve, confidence often improves right alongside it. 1. Glute bridges for posture, balance, and whole body support. Now, we come to the movement that deserves the top position in this ranking for most older adults. If you could choose only one bed exercise to influence posture balance, hip strength, and daily movement together, this would be a strong choice. The glute bridge does much more than work the backside, even though many people think of it that way. It activates the glutes, the hamstrings, the back of the hips, and the stabilizing muscles through the trunk. Together, those muscles form a powerful part of what supports upright posture and confident movement. When they weaken, the body often begins folding forward, relying too much on the front side and moving less efficiently. That forward collapse pattern is common in older adults who spend many hours seated or reclined. Over time, the glute muscles can become so underused that they contribute far less than they should. When that happens, walking may lose push-off power, standing may feel shakier, and balance recovery may become slower. That is exactly why glute bridges earn the #1 position in this routine. They wake up a group of muscles that many seniors desperately need, but rarely target directly in safe ways. To perform the movement, lie on your back with both knees bent and feet placed on the bed about hip-width apart. Bring the feet close enough to the body that your fingertips can nearly brush the heels. Before lifting anything, squeeze the buttocks together firmly so the glutes are already awake before the bridge begins. This pre-activation step is one of the most important parts of doing the exercise correctly. Without it, the hamstrings and lower back often take over, while the glutes contribute far less than intended. Once you feel that squeeze, press through the heels and slowly lift the hips toward the ceiling. Raise only until the body forms a gentle line from shoulders toward knees without forcing a big arch. Hold the top position briefly while continuing to squeeze the glutes and breathe normally throughout the effort. Then, lower back down, slowly stopping just short of complete relaxation before beginning the next repetition. That continuous control keeps the muscles engaged more effectively than lifting and collapsing between each repetition. For older adults, this exercise helps build the backside support that standing and walking depend on every day. It also supports pelvic control and may help the body feel more centered and less folded forward. That can translate into steadier posture, better balance reactions, and a stronger sense of push through each step. This is why the glute bridge is not just a bed exercise. It is a preparation exercise, a strength exercise, and a posture exercise all at the same time. And for seniors who want one movement with the broadest payoff, it is very hard to ignore. One reason this routine is so effective is that each exercise solves a different morning problem. The ankle work helps circulation and wakes up the foundation at the feet and lower legs. The heel slides help the knees move more smoothly before those joints must handle standing and walking. The marching movement improves hip lifting and core control so the body can step more clearly and safely. The straight leg raise builds front thigh strength for standing, sitting, and managing everyday elevation changes. And the glute bridge supports posture, hip drive, and the backside strength needed for stable mobility. Together, they create a much more complete preparation than stretching alone usually provides. Stretching may help you feel looser, but these exercises help you feel more ready. That difference becomes very important when you are over 75 and want to protect independence, because independence is not built from flexibility alone. It is built from circulation control, strength alignment, and the ability to react well under body weight. This is also why the entire routine makes sense as a sequence rather than random isolated movements. You begin by waking the lower legs, then mobilizing the knees, then rehearsing, stepping, then strengthening the thighs. Finally, you activate the large backside muscles that help keep the whole body upright and supported. That sequence feels natural to the body, which is one reason it works so well in the morning. It respects the fact that older adults need preparation before performance, and it offers that preparation without requiring a gym special equipment or an exhausting fitness mindset. For seniors who feel intimidated by long exercise programs, that makes the routine much easier to adopt consistently. And consistency, far more than intensity, is what usually changes the body over time. The most important thing about this routine is not doing every repetition perfectly on the first day. The most important thing is starting gently, staying consistent, and listening carefully to your body's feedback. If a movement causes sharp pain, severe dizziness, or anything that feels wrong for your situation, stop. If you have recent surgery, serious osteoporosis, concerns uncontrolled blood pressure issues, or medical restrictions, check first. For everyone else, begin with the most manageable version of each exercise instead of trying to prove something. Even 5 controlled repetitions can be a meaningful start, if that is what your body can safely handle. Over time, the body often responds well when movement is repeated calmly and regularly without panic or force. This routine usually takes less than 15 minutes once you become familiar with the flow. That means it is short enough to be realistic even for people who dislike formal exercise sessions. It can be done on a firm mattress or a softer one, as long as the body feels stable enough. And it can fit into the time between waking up and getting out of bed. Many older adults benefit from doing the sequence in the same order every morning for consistency. That creates a rhythm the body begins to recognize, which can make movement feel smoother over time. The routine also becomes easier emotionally when it is turned into a habit rather than a decision. You no longer ask yourself whether you feel motivated. You simply know this is how you prepare your body before asking it to carry you. For seniors, that mindset can be powerful, because the goal is not to perform like an athlete. The goal is to stand more securely, walk with more confidence, and protect the freedom of daily life. For many adults over 75, the hardest part of movement is not the afternoon walk or the trip outside. It is the transition from rest to motion, when the body still feels unprepared and vulnerable. That is why these 5-bed exercises can be so valuable. They help the body wake up in a safer order before the first step asks too much too soon. Ankle pumps and circles support circulation and prepare the lower legs for standing. Heel slides help reduce that rusty feeling in the knees before they take on your weight. Supine marching helps the legs lift more clearly while the core learns to stay stable. Straight leg raises strengthen the thighs that help you rise, sit, and manage stairs more safely. Glute bridges bring the hips and backside online, so posture balance and walking support improve together. None of these exercises needs to be dramatic to be effective, and none of them needs to turn you into someone who suddenly loves working out. They simply help restore the kind of support the body needs to move more confidently after waking. For older adults, that can mean easier mornings, steadier walking, and fewer moments of hesitation during the day. And those changes matter more than many people realize. Because when mornings become safer, the whole day often becomes less tiring and less stressful. So, tomorrow morning, before you rush to stand, give your body a better beginning. A few calm minutes on the bed may help you move through the rest of the day with more ease. And after 75, anything that helps protect strength, confidence, and independence is always worth your attention.